Which paranasal sinus has inward flow of mucus? Options are sphenoid, frontal, maxillary, ethmoid. Answer of this question is frontal sinus. In frontal sinus, flow of mucus is medial to lateral direction. It first goes along the intersinus septum, then roof, then lateral wall, then floor, then ultimately goes from natural ostium, frontal ostium toward the frontal recess. And rest of the other sinuses like maxillary, ethmoid, and sphenoid sinuses flows outwards. All ciliary beat toward the natural ostium and rest of the sinuses. So frontal sinus having inward flow. Mucociliary clearance is defined as cleaning of upper and lower airway by interaction of nasal mucus about 200 gram or 2 liter per day produced by respiratory mucosa. And this ciliary beating depend on number, structure and coordinated stroke of cilia as important as biochemical, physical and chemical property of the mucus is also important. Nasal mucus has weak, flexible, three-dimensional network from linear hydrated mucin molecules. So this mucus is formed by the hydrated mucin molecules. To prevent infection, this mucus is slightly acidic and physiological pH value between 5.5 to 6.5. Optimum mucociliary clearance is achieved at 37 degrees Celsius and 100 degree relative humidity. Nasal mucus is about 10 to 15 micrometer thick, has two layers. Inner layer is 6 micrometer thick liquid layer called preciliary liquid layer, which is covered by the viscous gel layer. This gel phase is structured by embedded mucin, and height of liquid layer is tremendous effect of efficiency of ciliary stroke. Nasal mucus contain 90% of water, glycoprotein as well as iron like sodium, potassium, calcium, magnesium and chloride. Nasal mucociliary clearance is a fundamental function required to maintain the health and defense of the nose and paranasal sinuses. Mucociliary transport is disturbed by the variety of conditions such as activity of cilia and congenital structural defect of the cilia like cartilage Gainer syndrome or primary ciliary dyskinesia and cystic fibrosis can interfere the normal activity of the ciliary function. Dryness can affect the ciliary function. At 50% relative humidity, the ciliary function stop in within 8 to 10 minutes, while 30% relative humidity, this will stop about 3 to 5 minutes. Other factor which also affect the ciliary dysfunction is temperature. At 7 to 12 degrees centigrade, this ciliary function completely stop. And other factors are like inhaled gas, wood dust, chromium vapor, tobacco, smoking, alcohol, infection are severely impaired the ciliary function.